We have a conception around addressing the silos in oral health care delivery, and that is where we talk about integration of oral health within the system that we have. We also talk about the things that we can do as part of models, but we also know that we need to make system change, but we also need to make social change. And that's about getting people to understand that everyone has a role in oral health and in improving oral health.
The aim of the MIOH program was to build the capacity of midwives to promote oral health during pregnancy by getting them to provide education, screening, and referral to pregnant women. It started way back in 2008 at Campbelltown Hospital in southwestern Sydney, where we had the midwifery unit manager there who was very proactive about promoting oral health, but highlighted the lack of knowledge and training in this area. So we developed this program, which had various components. The first component was an undergraduate oral health training for student midwives to promote oral health. In addition, we developed a continuing professional development program for practicing midwives, along with a very simple validated 2-item screening tool, as well as evidence-based oral health promotional resources that could be provided to pregnant women in the antenatal setting. Pregnant women are at greater risk for poor oral health, in particular periodontal disease and dental decay. We know that periodontal disease has been linked to adverse pregnancy outcomes, as well as it can affect glycemic control and has been linked to heart attacks and stroke. However, we know that pregnant women seldom seek dental care, mainly because of lack of awareness and misconceptions in this area, as well as limited access to dental care. In addition to that, we know that there's limited emphasis being placed on oral health by antenatal care providers. So the midwifery program, or the MIOH program, really aimed to capacity build midwives to provide oral health education, screening, and referral to appropriate dental services during antenatal appointments.
I've been really fortunate enough to be involved in the MIOH program, which is the Midwife Initiated Oral Health program at Western Sydney. And we've been able to integrate oral health education and practice into our undergraduate curriculums for nurses and midwives. And this has been really exciting because it's been the first time it's been done in Australia. And as a result, since 2017, we've had midwives in particular graduating with the skills to do oral health assessments. And even more exciting is that this is now extending beyond our state borders, and we have other states and universities taking this up, for example, in Victoria.
The undergraduate oral health module was adopted into the Bachelor of Midwifery program at Western Sydney University in 2015, and subsequently other universities have adopted as well. The Australian College of Midwives also endorsed our training program as a national CPD program for midwives, and since 2017 have been promoting it on their website. Our oral health promotional resources were also recognised and endorsed by New South Wales Health and other professional organisations like the Australian Dental Association New South Wales. And since then, more than 60,000 of these resources have been distributed across the state in various dental and antenatal settings.
The Midwifery Initiated Oral Health Integration Project has been going since 2018, and we have seen over 216 midwives enrol in that course. It is really important that oral health plays a significant role in women's health care, especially in early pregnancy. We know that only 1/3 of women access a dentist during their pregnancy, and there's a number of reasons for that. So this program has really enabled and empowered midwives to learn more about oral and dental health, which means that they can integrate that into their routine care for women, and that improves outcomes for women, but also access to care.
The program was also adopted into policy in Victoria. Dental Health Service Victoria has been rolling out the program across the state.
Since 2013, DHSV has offered the MIOH program to eligible Victorian midwives all across the state, and to this day 461 have been trained in the program. They work in a range of community health, public hospital settings, in Aboriginal health settings, and a range of other settings which offer antenatal care.
My experience has changed significantly since I participated in the oral health program project through the dental hospital, and it's been very positive of working with pregnant women through their journey and discussing with them the importance of dental health and oral health for themselves and also their unborn baby. Before I was involved in this project, the only thing I really knew about dental health in relation to pregnancy is that often women get bleeding gums while they're pregnant. But after participating in that program, I learnt that there's actually a lot more to it, and that the impact of poor dental health can be huge for the pregnant women and their unborn babies, causing things like premature labour and also impacting on the health of the unborn child. So it really changed my practice, and I know that sounds like a cliche, but it's actually true. I learnt so much from doing the program and getting access to the resources from the dental hospital and using those for my clients to work through what the actual outcomes might be if this wasn't addressed.
With a relatively small investment, DHSV can train up a range of midwives across the state, and what that means for women, pregnant women accessing services, is that they get someone who understands the importance of their oral health and can initiate those conversations about how they might maintain their oral health during their pregnancy, how they can access services to improve their oral health, and how that will ultimately result in healthier pregnancies and healthier babies. Interested midwives complete an expression of interest. From there, we give them a call and go through a few questions to make sure that they're eligible to participate in the program and be sponsored to complete the MIOH education program. From there, if everything checks out, they're good to go and they can start the online self-directed course. They have up to 4 months to complete it, and during that time, we're here available for support with any questions or help that they need along the way.
Over 216 midwives have completed the course from Victoria. They do make up 93% of the cohort that are accessing this course currently, and that is because of a sponsorship incentive that's available within that state. So we would urge other states and territories across Australia to look at ways to provide this course to nurses and midwives and allied health professionals to improve the reach, because it's all about access for women and families, in particular for rural and remote families, because we know their access to care is a lot more challenging than those living in the metropolitan area or city areas. Western Australia and New South Wales have also participated in the course, but in much lower numbers. But I think the feedback is really positive. So word of mouth and active promotion of this project would see increased uptake, and with a real focus on scope of practice for nurses, midwives and all health professionals, this is one avenue to increase outcomes for women, but also build confidence and capacity in the health workforce. The feedback the Australian College of Midwives has received from midwives undertaking this course has been overwhelmingly positive. You can undertake the modules in the home environment or also in work hours, and so the feedback has been that the content for all of the modules is very relevant to practice and also improves a midwife's confidence in having these conversations about oral and dental health with women and their families.
There's been a lot of impact. The first impact is that it significantly improved the oral health knowledge and confidence of new graduates as well as practicing midwives in terms of promoting oral health. And there's been greater emphasis now on oral health during antenatal care. Across the board, we've had more than 500 midwives across the country undertaking the training, and the model of care has been translated into 59 maternity services. And this has then resulted in a significant improvement in the uptake of dental services among pregnant women, as well as their oral health status, oral health knowledge, and quality of life. We've also found that children of mothers who had increased oral health knowledge had a significantly less risk of early childhood caries at the age of 4. So overall, we found that the MIOH model of care has been acceptable and feasible for midwives, and most importantly, it has been found to be cost-effective for health services, even with current referral pathways. Since the World Health Organization have a global oral health strategy on integrated oral health care, we are working with them to try and translate the MIOH model across other countries. The MIOH model of care has been adopted in many hospitals in the US, as well as in Tanzania, in Africa, and Iran. In 2023, the World Health Organization officially recognized the MIO program and included as a case study in their guidelines for preventing and controlling non-communicable diseases in reproductive health programs. The MIO program was the only case study from a midwifery and oral health perspective that was referenced at a global level.